When I finally had my child, my first child, when I was 23, I had gotten married. We were living in Birmingham. I had graduated from Florida State University, and, things were going well. And we got married. Here I am pregnant, having a baby. It's supposed to be the most joyous time in your life. And for a moment, it was. It was very joyous. However, very shortly after I brought that beautiful baby home, I started having feelings that didn't really line up with who I am as a person. Ashley is always, a light. It's always smiling. It's always joyous and having fun and the light of the party, not in a bad way, but in a very jovial way. And no longer was I this person. And many people call it the blues, right? They say it's just the baby blues. And I can assure you, if you have friends or family members who are experiencing these said blues, what I would love for you to do is to reach out to them and to connect with them and to let them know that they are not alone. Because, unbeknownst to me, it was when I experienced these baby blues that, little did I know on down the line, I would develop major depression disorder and generalized anxiety disorder. Well, I won't say most, but about 50 to 60% of women who develop postpartum depression end up developing a major depressive disorder later in life. And they end up also developing generalized anxiety disorder. So those are things that fortunately hit me, and I'm very thankful for that, actually. I don't say it in jest, I say it because that's exactly how I feel. If I had not experienced the postpartum depression, the rush, and I'm not sure if you guys know what postpartum depression is. I know there are several nurses in the room, but for the people who aren't familiar with postpartum depression, I'd like to tell you what it is. I was experiencing lots of crying. I was having lots of irritability, and I was upset with the world. Again, this is during a time where I'm supposed to be having a wonderful time with a brand new baby boy. But instead of, having that type of experience, it was filled with an experience that was very negative because I was so focused on fear, being afraid of everything, mourning for my mother. And the reason why I told you the story of her in the very beginning is because I did not process her death when she initially died. But when I turned 23 and had that child of mine, and I started going through the postpartum depression, it forced me to grieve her. And that was really difficult. It was very, very difficult for me. And my husband, thank God for him, he noticed that I wasn't quite right, that, I was displaying some symptoms that didn't line up with the essence of who I am. And he talked to me very lovingly and he said, Ashley, you've been doing this, that, and the third. That's not your normal behavior. And, I was like, I got a new baby. Of course I'm displaying all those things. But it's more than just having a new baby, okay? It is, when you have a new baby, of course you get tired, you get fatigued, but you take so much joy in taking care of that little baby, that bundle of joy. And that joy that I should have been feeling had turned into something that was very opposite of joy. It was me not wanting to take care of the baby, me feeling like I was going to do something bad to the baby, me feeling like, I'm inadequate. I can't care for this other human being because I can barely care for myself. And thankfully, I listened to my husband after a couple of months. Because trust me, I push back, in the Black community. We oftentimes believe that it is a quote unquote weakness to feel like you need to quote unquote go talk to somebody, right? However, that is something that we really need to flip the script on. And I say that with all due respect. We have to start understanding that mental health and mental illness affects us all, okay? Not just people who are non-African American, people who are non-melanated. That is not the case. Anyone in this world can develop mental illness, and everyone in this world should protect their mental health. It's imperative, okay? And so we're going to talk about in a few minutes what mental health is and what mental illness is. But I ended up seeing a psychiatrist. And I was living in Birmingham at the time, and I was very afraid of going to see a psychiatrist. But I had the most wonderful experience. And I'm so thankful that I did because, like I said, unbeknownst to myself, it's really what spurred my passion. I didn't know it at the time. However, because of the therapeutic rapport that the psychiatrist developed with me and how he carefully walked out with me the grief that I was trying to break down through, processing my mother's death at the time. He did that in such a beautiful and gentle way. And he helped me to understand that the whole mindset that I had, that pull yourself up by your bootstraps mindset that we've all been given at one point. We've all had that talk as a child in your parents' household. I didn't have this, that, or the other. You need to do this. And, what we have to remember is that today is a very different time than it was 30 years ago. And even when I was a child at the age of 15, that time is a very different time than it is right now. And so with that being said, we have to take into consideration the things that the generation are experiencing because it's very real to them. And another thing is oftentimes as adults, we tend to think that the issues or problems that we're experiencing are so much greater than everyone else. But it's wrong for us to not validate the issues that our children are also experiencing because they're very real to them. Okay? And if they feel like they're not validated by you, who are their parents, it can make them shy away from even speaking to you about the things that are going on with them. It can make them go into isolation, go into a depression, become self-injurious, and potentially take their own lives. And that's exactly what we don't want to happen. Okay? But anyway, so I developed this relationship, this rapport with the psychiatrist. It was great. And I later decided that I would become a nurse. And I became a nurse, and I went into the NICU, and I knew pretty much right away that it wasn't my cup of tea. I mean, I had a wonderful time with the babies, loved them, but it was a lot of death involved in the NICU. And that was very depressing. Okay, so I went to a rehab a little while, and then I went to Well Baby, and then God finally sent me to psych. And boy, am I glad he did. The first day that I walked into the psych unit, I was in my hometown, Auburn, Alabama, Opelika, Alabama, and I walked in, and honest to God, as cliche as this may sound, it felt like home to me. I have always enjoyed talking to people, really love having conversations with people, and I have always had a therapeutic type of demeanor or position or disposition. And even in nursing school, you always have patients that you take care of. And as you're going through the chart, you're talking amongst your classmates about what patient has what disorder. And I remember I would always get the patients that had mental illnesses. It was really funny, but I had such a way with these patients, and I didn't really see it as a job. I saw it as a get to and not a got to. And I thank God that He laid it on my heart, to continue with nursing by becoming a provider. So after we moved to Texas, started working for the VA and went to acute psych and stayed there for several years until I went to patient safety with Dr. Beeman. And then, I was in school again to become a nurse practitioner. And so here we are. And I can tell you without a shadow of a doubt, this is my life is so fulfilled by talking to patients, by interacting with patients, by creating treatment plans, by seeing people go from, having very guarded dispositions, being very afraid and scared, not opening up to, at the very beginning of our conversation, to walking out of the room and hugging me because they are now a believer. They believe, they have hope, they believe that things are going to get better, and that's just very powerful. So I wanted to talk a little bit, now that I've given you that long intro, about mental health and mental illness. So many people have different meanings and definitions of what mental health is. Does anyone want to help by calling out what you think? Like, is there a word that you think of when it comes to mental health? Anyone? Crazy. Okay. Anyone else? Depression. Anyone else? Suicidal. Okay. Anything else? Psychotic. Okay. Okay, those are great words, right? All of those words are more associated with mental illness. Okay? You just proved my point. So many people, when they hear the term mental health, they think that something is wrong. I'm here to tell you it's not. Mental health makes up so much for you and I. It makes up your cognitive space, your ability to socialize with others, your ability to have conversations with others. It influences your cognition, your ability to think, take in information. It influences so much in our lives. It is not a mental illness. It is not a mental disorder to say I need to focus on my mental health. Okay? I need to focus on my mental health. What that means is literally that the person may understand that they are getting cognitively bogged down or cognitively overloaded, and they need 5-10 minutes that they can step away. Maybe if they're a nurse, they step away literally off the floor because they've had a caseload that is very taxing. Maybe they've had 5 or 6 patients, and these patients are really equivalent to 12. We've all been there, where you don't have to be a nurse to understand what I'm saying, but you are very, very busy on this particular day. Okay? So what it means is that you recognize that you are processing so quickly, you're getting very inundated, and you need to calm down, and you need to go do some breathing, okay? And literally, what I hope that you do, and I'm going to teach you this, is that when you are feeling that way, because it can be any of us that have times where we feel like it's just too much, okay? I need a moment. Walk away, go to the bathroom if that's the only place you can go, or go outside if you can, and I'll talk to you about the benefits of going outside in a moment. But do some deep breathing and let out all of the angst that you have inside. And I'll tell you a beautiful story. to get you to remember how to breathe. Okay. A couple of weeks ago, I have a 6-year-old. His name is Braxton. And a couple of weeks ago, Braxton brought home a sheet that he had colored. And it was really beautiful. It was a basket. And the basket, it was just so colorful, red, blue, green, purples, yellow. And I was looking at it and I said, Braxton, what do you have here? And he said, oh, it's how I breathe, Mama. It said birthday cake breathing. I don't know if I sent this to you. It said birthday cake breathing. Have you all ever heard of that before? I hadn't either, okay? And so I looked at it and I said, Braxton, what does this mean? And he said, Mom, when you're feeling too much, if a friend makes you upset, you have to do that. I said, okay, tell me how to do it. And he blew a bubble in his mouth. He goes, he's blowing out a birthday cake. He's blowing out a birthday cake. And I said, that is all right. I was stunned. I was shocked that my first grade son, I'm so thankful that the teachers and that, midway school system, and hopefully all school systems are doing this, but if they're not, they need to start, that they are teaching kids that there are ways to handle stress, okay? And those ways to handle stress can be found within. I thought it was the most beautiful thing. And so we practice birthday cake breathing at home all the time when I need him to slow down for a minute. But anyway, so I say all that to say when you go to the bathroom, maybe you don't do birthday cake breathing, but do some breathing. That's really the easiest way that you can think of it, blowing a bubble and blowing it all out. The bigger the bubble in your cheeks, the more air, hot air, angst, anxiety, pressure, depression, whatever it is you're feeling, the negativity, the cognitive distortions, the things you tell yourself, the ruminations that, creep up in your head that have no business being there, breathe that out because it has no place within you, okay? Go to the bathroom, or if you can't, you can go outside. The benefits of being outside are just amazing. Does anyone know what being outside in the sun, what type of benefits it has on you? Anything? Vitamin D, absolutely. Absolutely. Yeah, absolutely. Thank you so much. Vitamin D is absolutely essential in our bodies, okay? So many people who are darker complected or, African American or have any descent that's not the Caucasus descent have issues with vitamin D deficiency, okay? And if you ever go to your doctor and you get labs, make sure that you request that lab because that is not a normal lab on the panel. That is a lab that that your doctor is either going to put in separately or you're going to request and say, hey, can I see what my vitamin D is? Because I guarantee you more than half of you all in this room are deficient, okay? Now, who cares, right? So what? I'm deficient in vitamin D. I care. And you should too. The reason why is because vitamin D deficiency can lead to depression, or it can worsen your mood that you're in. And that's very important. And what I'm trying to illustrate to you is that there's so many things that are within our own power that we can do that we don't do. Maybe it's because we don't understand the importance. Maybe it's because we're afraid of finding out information. But don't let that continue to be an excuse. There's so many things that are within your power. You can breathe, right? You can go outside. And the best time for you to go outside is morning sun. The morning sun is best because for some reason it helps with that circadian rhythm. It helps you at night in terms of when your melatonin is being produced in your body. For some reason, that morning sun, it tells your body, even though it's nighttime, hey, I had this sun at this time. It's time for my body to start making melatonin. Okay, melatonin is natural in your body. Yes, there are melatonins that you can buy in the store. I encourage you to do so if you're having a difficult time sleeping because it's natural. Okay, don't be afraid of that. Oftentimes, I prescribe it to my patients. I either give it to them in 3 milligrams or 5 milligrams, but you know your body more than I do. You look at it, and if you're having a difficult time sleeping, rather than you taking a strong medication, or being afraid to take anything, don't be afraid to take something natural, or don't be afraid to go outside in the sun and absorb that natural vitamin D and that natural sunlight to trigger your circadian rhythm at night so that you can get more rest and get rest that's actually restful and not a rest that's full of you waking up every 2 to 3 hours and not getting the sleep that you really truly deserve. And we'll talk about sleep in just a second. So we talked about mental illness and what all it encompasses, which we said was psychology, social well-being. We also said it influenced cognition and perception and behavior, but it also determines how we handle stress, okay? Because if you're not taking care of your mental health, it's going to be very difficult for you to be very resilient. Does that make sense? I mean, if you're overstressed and you're cognitively overloaded, it's going to be very difficult for you to even handle maybe interacting with coworkers, family, friends, your pet. You're going to be irritable. You're going to be in a bad mood. And so much of this, as I said, is in our control. We can control these things, or we can help we can help more than we think we can. Okay? And so the next thing that I wanted to talk about is mental illness. And many of you threw out words. I believe every word that was thrown out was more so related towards mental illness. But mental illness is so different from mental health. All of us at some point need to be concerned about our mental health and need to be good stewards of our mental health. However, mental illness, not all of us are ever going to develop that. I have it, and that's okay because it makes me a much better provider to my patients because I can sit before them and I can say, when they're handing out all the excuses in the world on why they can't do this, that, and the other, I can look at them and I can say, listen, you're talking to someone who's had major depression and anxiety for 16 years, okay? You're talking to the face of mental health, or the face of mental illness. So often we believe that people who have mental illness are beggars on the street. It's not true. Several of you in here have it or potentially have it. And that is nothing that you should be ashamed of. And the reason why I'm being so blunt about this is because we have to normalize the conversation. We have to get used to the fact that this exists. And that is not a bad thing. Because as long as we pretend that it doesn't exist and we put it in a Ziploc bag and put it in a big trash bag and put it in a, another bag and put it in the closet and put pillows over it, people are going to continue to think that you're strange for having depression or you're strange for having bipolar. How could you be strange for developing something genetically that you were predisposed to? Some people are born without legs. Some people are born without arms. Some people develop hypertension. They develop cancer, right? They have all kinds of medical conditions that they did not cause themselves. Yet we don't look at them and say, oh my God, you have hypertension? You know, don't talk to her. She has hypertension. I'm sorry to be this way. I'm just being honest. You know, we don't talk to him. We can't be that way because this is what sends people over the edge. And I can tell you something from my personal experience because I don't talk about anything that I have not lived myself. So I can tell you from my personal experience, the thoughts that I thought when I first became diagnosed with major depression and when I later developed anxiety, they were very negative. I thought all of you saw my forehead, something's wrong with her. I thought you could, just tell that I had this and that it was the end of my life as I knew it. But that's because at the time that I, got that diagnosis, that's what they were feeding us. If there's one thing that COVID has done, and I thank God for this, it has made us more aware. It has heightened our awareness about mental health. Okay? It has taught us about burnout, how to avoid burnout, although we didn't learn how to avoid it until we had been in it for so long. Right? So I challenge you to, if you have negative thoughts about those who suffer with mental illness, I challenge you to reframe those thoughts immediately. Because if you don't, you never know who you're pushing away. It could be your daughter. It could be your son, your grandchild. Okay? It could be a friend of your family, your sister, your brother, your mother, your father, who have hidden this thing from you because they're so afraid of being labeled, when in actuality, it should carry no label. We don't label hypertension. I have to keep going back to the physical illnesses that people have. If physical illnesses are not labeled in that way, then mental illnesses should not be either. Okay? Okay, so I wanted to talk to you specifically about sleep. That's another part of our mental health that we need to protect. Sleep is vital to our health. Do y'all understand how important sleep is? Oh, man. It's so important. I'm going to give y'all 10 seconds to think about it. What do you think happens during the night as you were sleeping? 10 seconds. Renewal. I love it. Love it. You are all over. You knew what I was looking for. Anybody else? Okay. As the body is asleep at night, it is literally repairing itself. Okay? So if you go to bed at 2 a.m. because you're not sleepy or because, you don't want to go to sleep for whatever reason, some of us have nightmares, y'all. We do. I talk to people every day who have nightmares and they're afraid to go to sleep. Used to be me. I'll tell you a quick story. When I had my second child is when I got diagnosed with generalized anxiety disorder, because when I had him, it was a scheduled C-section. I'm just telling y'all everything. It was a scheduled C-section. And we went in, it was supposed to be a 30-minute procedure. And it ended up being 5 hours. If it's going to happen, it's going to happen to Ashley, okay? So anyway, went in, and they I saw them take the baby out. I saw the baby, and all of a sudden, the doctor said, Miss Evans, we're going to have to put you to sleep. You're hemorrhaging. And if we don't put you to sleep and take out all of your organs, to do a full hysterectomy, you will die. That's what he said, very matter of factly. And I was like, okay, put me to sleep. But the reason why I'm telling y'all that is because, do you know how traumatic that was for me? Here I am. I have a 9.5-year-old who's out in the waiting room waiting on mama. I have a new baby. My husband is holding the baby, and he's being led out, and I'm being told, you might die if we don't hurry up and do this. And so when I got home, every time I was about to go to sleep, what was I thinking about? Not waking up. So what happened? I didn't go to sleep. I waited until the daytime to go to sleep. And many people who suffer with insomnia do that. Okay? They're much more afraid to sleep at night because everything's quiet and still. But during the day, they can sneak in a cat nap or two because it's light outside and they feel a little protected by that light. That was me. I cat napped when the baby was napping. And you can only do that for so long before it catches up with you. And, it was one of those things that really it was post-traumatic syndrome disorder. That's what it was, post-traumatic stress disorder. That's what I developed as a result of that happening. And I say all that to say, guys, it could be anybody. It can happen to any of us. And so we just have to treat each other with compassion and treat ourselves with compassion. Because we don't cause these things. They just happen. Okay? And so let me get back to sleep hygiene. I'm sorry. I had to depress y'all for a moment. I got sad myself when I told that story. But I am truthful and transparent for a reason. I'm no longer at the point in my life where I'm ashamed of the things that happened to me that were beyond my fault. I'm okay with it. And God has given me a voice. And you know what? I'm going to talk about mental health until the stigma is no more. That's what I'm going to do. Okay? And if it makes people uncomfortable, good. Because that when you're uncomfortable about something, that is exactly when things develop and grow. Okay? Okay, so sleep. Your body is repairing itself. It's repairing the brain. It is downloading. Your brain is so awesome, by the way. It's downloading everything you did that day. Isn't that cool? It's like, okay, she did this, she did that, blah, 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 blah. It's just like the most fascinating thing ever. And if you're not resting, it doesn't have an opportunity to download and process all those things that you did. So if you're not resting, no wonder why you're forgetful. Do y'all understand what I'm saying? You can't remember anything. You're not resting. You're not getting sun. Vitamin D, vitamin B12, it leads to being very forgetful. There's so many things that are in our control. But anyway, so the body is repairing itself during the night. And guess what else is doing? It's fighting against negativity. And this is really awesome how it does this. When you don't get enough sleep, you're predisposed to being extremely negative. You could hear that, something really awesome happened, but your response to it initially, it won't be what you say out loud, but your response to it internally, it'll be negative. It'll be like, she thinks she's all that. Oh, you look so nice today, kind of thing. you know. So it predisposes you to being very negative. However, when you get a good night's rest, you are more positive. The thinking that you have, when you wake up feeling refreshed, you feel good, you're ready to go, man, you could solve world hunger that day. Right? And y'all know what I'm talking about. But when you don't get enough rest, man, it feels like Monday, even on Friday. Right? You're ready to go. Every experience, if I'm a nurse, so all of my experiences, I'm talking about, being a nurse. I'm like, y'all, this doesn't happen to me, okay? Because even on my bad days, I give you 100%. They can attest to this because they know me. I give 100 even on the bad days. Inside, I'm thinking something else. But I pray and keep it moving. Okay? And I say all that to say sleep is extremely important. If you are not getting enough rest, well, starting tonight, you will, because we're going to create a sleep hygiene routine. I'm going to tell you about it. This is what I tell my veterans every single day. Many of us drink caffeine. Do any of y'all drink caffeine? Yeah. Yeah. Well, guess Tina. Who's Tina? Tina. It's nothing wrong with caffeine every now and then, but I personally, Tina, I drink decaf. There's nothing wrong with caffeinated, but I'm very sensitive to things, so I just drink decaf. So anyway, as it relates to setting your sleep hygiene routine, I challenge you to not drink any caffeinated products, whether that is coffee, energy drinks, or whatever it is, sweet tea, within 6 hours before bed. Really and truly, that means your last drink of caffeine needs to be at lunchtime if you're going to have it. I know that might be hard because a lot of people want a Coke at dinner. It's not worth it because you don't realize what your body is going through inside. Okay? In actuality, all that caffeine just leads to more inflammation. And guess what the inflammation is? It's stress. And guess what stress does? It makes you eat. And guess what eating does? It raises your glucose levels. It's just a whole big old, domino effect. So we're going to stop drinking caffeinated drinks within 6 hours of going to sleep. And if we are smokers, you have to stop the smoking. Y'all, I'm just real blunt. I'm sorry. If you have family members that smoke, please encourage them to stop smoking. And they don't have to do it alone. There are so many things that are available to us to help us. There are medications to help, gum to help. I challenge you to seek help at your doctor's office or just go to the pharmacy. I believe they even sell gum over the counter, right? Yes, ma'am? Yeah. And it is awesome. I don't care if you've been smoking for 30 years. It's worth it for you to stop right now. Because actually, there are studies about this. By stopping now, you are reducing your risk of heart attack by several percentage points. I don't know how many, but a lot. Okay? So it's worth it. Okay. Another thing that I want you all to do is, and this is going to be difficult, and I hope that you're going to talk to your children about this too. Take the technology out of the bed. What do I mean? What do I mean by that? Yes, your phone, your iPad, all of those things, take them out of the bed. Because you just lay there and instead of you resting, my dear, you are on that phone. And guess what it's doing to your eyes, your vision, your brain? It's stimulating them. It's saying, I don't want to go to sleep. I don't care about that melatonin. I'm up. Let's go. And that's not what you should be communicating to your body. at 9 o'clock and 10 o'clock and 11 o'clock at night. It should be that it's time to start resting. Okay? Create a sleep schedule. And what I mean by that is, you know the things that you need to accomplish at home before bed. If you know you can accomplish all those things by 7 o'clock, watch a little TV, and by 8:30, take your shower at 8:30. Go ahead and take your melatonin or whatever it is, at 8:30 after your shower. Get out of the shower, do your self-care. Be excited about that self-care. Go get you some new lotion. Get some with lavender in it, or get you some lavender oils, essential oils, put it on your neck. Let it infuse into your nostrils, and man, you're talking about calm. Get you a cup of chamomile tea, which does not have caffeine. And my favorite thing is to turn on the Calm app, which you can put on your phone. And it sounds like white noise or thunder and lightning or a stream, anything like that, rain. It's very soothing. If it's not soothing to you, maybe you should turn on Mozart. I don't know, but something very soothing. And while you're listening, my very favorite thing, well, it's two favorite things I have at the very end. But while you're listening to that white noise, journal. And I know a lot of y'all are like, journal, I am not doing that. But guess what? My veterans love it. They really do. I tell them, and you'll love it too after I say this, for those who struggle with negative thoughts, with cognitive distortions, I'm bad. I'm the worst person in the world. How could I have done that? I don't do this enough. I don't look like this. I wish this. And dwell on those things, because often that's what we dwell on. We dwell on things that we believe are our shortcomings at night. Instead of doing that, journal about 3 things that you're grateful for. And when the enemy comes in and those thoughts try to overtake you and make you feel less than what you are, which is worthy, when those thoughts try that, you open up that journal, or you start thinking about the things you wrote in that journal, which are near and dear to your heart. It's going to be things like my kids, my pets, my spouse, my home, my pastor, my sister. And when you start thinking about those things, those negative thoughts can just get out of the way. Because you're so thankful for the things that God has given you. And it can transform the way that your outlook is on life. And instead of you giving in to the negative thoughts, you become a victor. Okay? You take the power back. And that's exactly what I challenge you to do with your thought life. Okay? And the very last thing that I want you to do in your sleep hygiene routine is pray. You got to do that. I mean, and when you pray, you thank God for things that you might not even see yet. Thank you, Jesus, for taking those negative thoughts out of my mind and for giving me a clear mind, a clear vision, for allowing me to, be level-headed, for allowing me to, whatever it is that God is allowing you to do, allowing me to be alive, breathing, lying in a nice warm bed, having the meal that we had for supper. Thank you, Jesus, for giving me the ability to just be a friend to others, be a sister to my sister, be a support system, be whoever it is that you know that you are. Thank you, God, for giving me the life that you've given me. Thank you, God, for blessing me from the crown of my head to the soles of my feet. you might hurt, but thank him for that body that you have. Okay? And as I said, dwell on positive things and not the negative ones. And real quickly, I would like to talk for just a moment, and then I'm going to give you all an opportunity to ask some questions. But I just wanted to make sure that you're aware of the signs and symptoms of depression. Okay? Because it's rampant. And many of us are suffering in silence. And we need to know the signs. Anxiety is a sign, okay? Always moving, always tapping, always, doing something with your hands, can't be still, being restless, okay? Not being able to concentrate or focus, not even being able to read the newspaper or watch a 30-minute TV program. Those are signs of depression. Losing lots of weight, gaining lots of weight, and you're not intending to do either one of them. You don't have an appetite, or you eat and you don't even realize you're eating. All those are things, those are signs that, you might have some depression. Insomnia, we talked about that already, not being able to sleep because the thoughts are getting away from you. Feeling very fatigued and hopeless. Life doesn't matter. I wish I could go to sleep and just not wake up. My dear, that's depression. And if you feel that way, you need to seek help, because there is hope for you and there is help for you. And please don't be afraid to seek it. We're here with open arms waiting for you to come through the door. And when we see you, we're so glad that you're there, because we want to take care of you so desperately. And we want to see you get to the other side where there's joy. Okay? And lots of thoughts of death. Most people don't realize that that's depression. When you are having, thoughts where you're afraid that you're going to die, you think you're going to die, your thoughts are just wrapped up in death. I was there. Everything I thought, it was on the backdrop of death. Thank God I'm not there anymore. That is a very lonely place to be, and we don't want you there alone. We want to go through it with you. We want to hold space for you, with you. Okay? So I challenge you to please talk to initially, the easiest thing for you to do to seek care if you are experiencing any type of issues with mental illness or having difficulties managing your mental health, the easiest thing for you to do is to seek out care from your primary care physician. And then they can then refer you to a mental health professional. Of course, I'm a little biased because I am a psychiatric mental health nurse practitioner, but I personally believe that the best mental health care and the best care for mental illnesses is by a mental health professional. Because oftentimes primary care physicians, I won't get on this soapbox, but they underdose because they're afraid. They underdose. And so guess what, sister, brother? You're still suffering. It's like a placebo. You're taking it faithfully, and it's not working. And it's not because you're doing something wrong. It's not because the doctor did something wrong. He's just trying to make sure that he doesn't overdo something for you. But you have to seek out care for people who specialize in that area, where they see the signs, they understand what they're looking at, and they can treat you efficiently and effectively and give you medication that will work in the best efficacy possible. Okay, so what questions do you all have? Just a couple of minutes. Tina?
I have a question. With the uptick in the use of marijuana, are you also saying that that is looped in with not smoking? That is that something that also could possibly contribute to problems the way that nicotine would?
Great question, Tina. Absolutely. I would never um, tell a patient that I believe it's okay to smoke medical marijuana because, in my opinion, and I know we're at the church, I didn't know they were going to ask that, y'all. Okay? I didn't know. But in my opinion, until this is legalized, it's illegal. And guess what? You don't know what you're taking. So many people, I have to be real with you guys, so many veterans smoke marijuana to sleep. And it's because they have PTSD and it's bad, it's severe. Okay, and that marijuana, they feel like it calms them down, but they don't understand that you never know what's going to be in that drug, and it can make you psychotic in a moment's notice, and you will never be the same. Some people have died from, having marijuana laced with things they have no idea what's in there, go into a coma. There's so many detrimental side effects. It could actually trigger bipolar in a person. So the bipolar might be latent in your body, which means it's there, but it hasn't really risen to the surface yet. That bad marijuana, it could trigger it, and you will never be the same. So I would definitely stay away from marijuana, CBD, and AFG. All of it. Okay? Treat things the right way. Does anyone have any other questions?
Hi, I'm Tanya. I
Hi.
really enjoyed your the presentation.
Thank you.
What are your thoughts on, I guess, alternative therapies, for mental illness, outside of medication?
Great question, Miss Tanya. So there's one thing I got to tell you in the very beginning. We no longer call it alternative because there's a negative connotation to that word. We call it complementary. Okay? We don't want people thinking that we're giving them something that's subpar from everybody else, because that's not true. Alternative, I got on that, Miss Tanya. So alternative medicines for what? Sleep?
Just for mental health or mental illness.
Mm-hmm.
Um,
Oh, good. There's so many. One that I actually did for a while myself was yoga. Y'all, I was having lots of back pain a couple of years ago. And when you have lots of pain, have any of you all had pain for like weeks at a time? It is miserable. It can really lead to depression or a depressed state. So I started going to a yoga. And y'all, when I started going, I was so ashamed. I was like, oh my God, they're going to look at me and they're going to say, you can't do this yoga. Y'all, I did it and it made me feel so much better. I did it very slow, Miss Tanya, and I went to a beginner's class, and I did that beginner's class like 10 times. I was going to get those steps down, okay? And so I did that for a while to make myself, feel better and feel like I could do it. And then I worked my way up. Now, I never got beyond like the first two classes because then COVID started and they shut down everything. But it actually helped me so well. Another thing that you can do is Tai Chi. I don't know a whole lot about Tai Chi, Miss Tanya, but I know people do it and it's akin to yoga. Lots of people do acupuncture. Okay, and I have heard very good results from that from people who are in constant pain. We have it at the VA. It is something that veterans rave about. They say that it has done the trick for their pain. Massages, little do you know it, massages are healing. They are. You go to, and I'm not talking about a pop-up shop massage kind of thing, where you sit in the chair. I'm talking about a real, deep tissue massage, a Swiss massage, those expensive ones. They know what they're doing. They know the spots. Miss Tanya knows what I'm talking about. They know the spots in your body that release pain in this spot, that spot, that help with anxiety, that help with moodiness. They know the spots, and that's a great way to help in an alternative fashion. And then there's also supplements that one can take as well that lift your mood, so to speak. There's one that focuses on, there's vitamins. You know, you take vitamins and that lifts your mood. And there's also beverages that you can drink that lift your mood. I can't remember what they're called, but Miss Tanya, I can get with Dr. Beeman, forward the information to her and send it to you. But these are wonderful products because they give you energy and they give it to you without stimulating you with caffeine. Because it's filling you with great things like lutein. Lutein is in your brain already. But when you put a lot of lutein in a glass and drink it, oh, it gives you lots of energy. I folded 7 loads of clothes in 45 minutes, like 3 weeks ago. And it's because of that. But anyway, so yes, there's lots of great alternative things that are on the market that I would, definitely suggest that we look into rather than doing something that's medicine.
Thank you so much for that.
Thank you. Yes, ma'am.
I was just going to put a plug in for when you talked about yoga. Well, Miss Tanya actually is a yoga instructor.
Miss Tanya, you
And
were
so-
holding out on me.
And so we are now beginning to offer those classes here because we know that it is very well needed to get that stress relief. So Miss Tanya is actually doing yoga classes on Tuesdays here at the church.
Oh my God, that's beautiful. I love it. I need to come. And mindfulness is another one that we need to do. Y'all, it doesn't take anything but a few minutes of your time to literally just get in a space that's quiet and, just calm down for a few minutes and breathe and do some focusing, some mindfulness. Just try to clear your mind of things that have clogged you all day. So I encourage you to Google these things, and I can put these things together in an email to Dr. Beeman and send it to you, okay? Yes, ma'am.
Okay, so is there something that you can do or that you can take besides psychiatric drugs when you have anxiety and depression? Speaking for myself, I am on medication for anxiety and depression. Is there anything natural that you can take or anything you can do to help with that besides taking medicine?
Well, the things that I already mentioned, and without me, knowing your medical history, I wouldn't be able to accurately give you, a treatment plan. But the things that I've already mentioned definitely will help. And it's simple things like, the sun, exercise. You would be very surprised with going for a walk does. And I mean a walk where you're not even trying to go fast. Research has shown that real exercise where you're like trying to lose weight or you're just trying to be healthy is not when you break this huge sweat. It's when you consistently do it over 30 minutes, over 45 minutes. But that is what research has shown is not a person who runs 5 miles. It's the person who walks 2. It's the walking. It's that slow walk that is helping the brain and the body to get to a place of breaking down the inflammation, decreasing the stress levels in your body. It's not that quick spurt of running that does that. And in addition to that, the swimming can do that. We're in a time right now where it's hot outside, and swimming is one of those things that you don't think you're exerting a lot of energy, but you really are. You're exerting more energy swimming than you would be running or walking. And that's just you wading in the water. I'm not saying actually swimming, because many of us don't know how to swim. Yeah, I don't know how to swim. I'm being very honest. I never learned as a child. That's why both of my kids know how to swim. I'm afraid of the water, but anyway, that's another subject. Okay, so, sorry. Okay, but what I was saying was literally, if you don't know how to swim, put on you a swimsuit and walk in the water. That burns tons of calories, and it aids in lowering that anxiety and depression. Okay, let's see what else. And your vitamins, your multivitamins, things like that. Looking at your vitamin D level, looking at your vitamin B12 level, all of those things. Now, there are some things we just can't help. There are some situations in our lives beyond our control that occurred, and we just need medication. What does medication do, y'all? Medication, let me just tell you real quick, because I know we're a long time. Medication levels out the serotonin levels and the dopamine levels and the norepinephrine levels in your body. And that's very important, because not all of us have the same amounts of those neurotransmitters that I just mentioned. And it's not because of anything that you did. It's just because that's how your body is, right? So when you start taking an antidepressant, the body is basically reacting to it by saying, oh, you just took an antidepressant. This one is to raise serotonin levels. They're down here. Let me bring them up, because this is where they should be. Okay? And as a result of that, your mood should lift. That's what serotonin is supposed to do. It's supposed to lift your mood, okay? And make you feel not necessarily happy, but like you can deal. I can deal with some things because I'm feeling how I feel very resilient, like I can handle some things today. Now, if you're still feeling like even on medication, you're experiencing a great level of anxiety and depression, then something needs to be tweaked. Because either you've been on it for a long time and it just needs to be titrated up, or if you're already at the maximum dose, you might need to be switched to something else. Again, I don't know your treatment, so legally I can't tell you what to do, but I can make suggestions on things that you can talk about with your primary care physician or your mental health professional. Yes, ma'am.
Can I ask my question first, ma'am? Can you discuss counseling as it relates to mental health? Because I know, as believers, sometimes we think we don't need counseling, and that's a stigma as well. If you go to counseling, you don't have faith and things of that nature. And how do you know if you need it?
That is such an excellent question. Thank you so much for bringing that up. That's great. Counseling is extremely important. Therapy is very important. I wish that people would understand that therapy is something that we all should seek out, because none of our lives have been peaches, cream, strawberries, and ham sandwiches every day. We have had struggles in our lives. We have been placed in situations and circumstances that we were not able to control, and it caused a great deal of angst for us that we might still hold on to. There are things that have happened in our families that we know happened. They affected us, and we don't tell anybody about it. And what happens is, the reason why this is so important is because when you are a child, your schema is created. What is a schema? The schema is the way to which you respond to things by your behavior. It's created by the people who you look up to the most. It's created by your parents. Okay? So as your parents model behavior and interact with you, if they're slapping you because you ate a piece of cake, You know, your schema is going to develop a shame and a guilt associated with eating. Okay. And so as a result of that, you might start sneaking food. And then when you become older, you might start eating food all the time because the way that you were raised, you were afraid to eat. The schema is very important. So you have to reframe that thinking. And the brain is so wonderful. It's neuroplastic. It's called neuroplasticity. And because of that characteristic in our brain, it allows us to reorganize the things that we experienced as a child that have contributed to our behavior as an adult. You know, there are so many people who have been sexually assaulted, raped. Those are very traumatic experiences. We have to seek mental care for these things. We have to tell people. We have to be honest so that we can process that pain, because it's extremely painful. And if we don't process that pain and yet hold on to it, then every relationship that we have, okay, we have that relationship and we function out of the lens of that assault that happened to us. So it's very important. And in terms of counseling and Christians and faith, you know, personally speaking, the church is in a wonderful position because so many look to the church and they see it as a place that they can trust the people who are in it. And that's wonderful. And I know that the people who you have around you in this church are very capable of giving you counseling. However, I would also say this. Some things need to be still handled in a very organized, programmatic way within a counselor's office, a therapist's office. I'm not a therapist, but I am licensed in the state of Texas to be able to perform psychotherapy. But on a day-to-day basis, I do medication management. But every patient gets psychotherapy because I know the importance of it. I know that in order for people to really have effective treatment, they need to get out things that's on their mind. It's not just shoving pills down people's throats. Some people are ashamed to tell the pastor because they're afraid that the pastor is going to think differently about them. Y'all, these are things we don't think. They're not. We thank God that you came forward and got it off your chest. But if there are things that you want to get off your chest and you don't feel comfortable to do that here, you should still seek care elsewhere. You know, even go to them and say, hey, who do you recommend? You know, because I'm going to start this journey and I want to be serious about it, you know. And I guarantee you you will have their full support. Counseling, and when you put it with medication, if you need medication, it's a great combination. But even counseling by itself will do amazing. It can transform a person's life and allow them to let go of all those demons that have been holding on to them for so very long. Okay.
I promise my last one.
She can go first.
You touched on the fact that the person still needs to get things off their mind and that they do need to be a part of a clinical program. Is that part of the reason why a person can be, say, on these medications and still have suicidal thoughts? Like, for example, what happened with Robin Williams. Is it because there's a missing piece that causes them to still go down that path even though they've been given the medication?
Well, you know, and thank you for that question. I can't speak directly to Robin Williams, but I don't know what kind of medicine he was on, if he was on any medicine. But what I can tell you is that some people are chronically suicidal. Some people, no matter how much medication you give them. They are high functioning individuals that will not ever show you that they are suicidal because they struggle day in and day out fighting that thing. They fight it. And so if they are fighting it internally, but on the exterior, it looks as if they have it all together, you're never going to know that their medicine might need to be changed. They're chronically suicidal, and so many people are like that. For other people who are on medication and they deal with having SI, is what we call it, some medications can actually increase SI. Okay? We need to be aware of that. If your loved ones get on psychiatric medications and they start having these thoughts about hurting themselves, you need to rush them back in, because that can happen. It's a side effect that we don't want your loved one or yourself to be experiencing. Your medication needs to be changed. Okay? That might be something that's a medical emergency if you can't get into the clinic that particular day. But outside of that, in terms of others who are suicidal, there are others who are suicidal who are on daily medications, but maybe those medications need to be titrated, or maybe those aren't the best medications for that person. Because unfortunately, Tina, psychiatric medicine, psychiatry is a science, right? It's a science. However, I cannot look at you and read all of your medical records and know this medication is going to solve all of Tina's issues. It is literally a stab in the dark, and I hate to make it sound that way, but I'm very honest. I take in what you tell me. I ask you a series of questions, and based on the information you give me, I can tell you the best couple of 3 or 4 medications that you should use. And then at that point, we try it. If it doesn't work for you, guess what? We get you off and you try something else. Because unfortunately, none of us know what is the magic pill for you. Now, there are, fortunately, tests that you can undergo that are quite expensive, like $3,000, $4,000, $5,000, that are panels that will tell you exactly the medications that will work for you. And it's wonderful. And we put you on those medications, and it's just like a key in a lock. It's just wonderful. But so many people can't afford that. Yeah. You're welcome.
Hi, Ashley.
Hi.
My name's Whitney. I work at Central County Services,
Yes.
formerly known as MHMR. So I just wanted to add to something that you said about the stigma. I think when it comes to mental health, it's the same as our physical health. We can have
Exactly.
great physical health, or we can be struggling, and it's the same with our mental health. So we all have it. It's just we're fluctuating, and you can be anywhere on the spectrum. But the most important thing is to listen to your body, just like we listen to our body with physical things. If we don't
Exactly.
feel right, we go to the doctor. It should be the same thing for our mental
Absolutely.
health.
You just summed it up so beautifully. That is my wish every single day, that people would start taking this or seeing this in the same way that they do physical health. We don't bat an eye and we're at the doctor's office because something hurts. And I thank God for you doing that. But guess what? Not all things that hurt can be seen. Yeah. So, with that said, I pray that this conversation does not end here tonight. I pray that you talk to the others around you. See one, do one. Miss Carol can tell us all about that, can't you, Miss Carol? See one, do one. See one, do one. Meaning you saw this presentation, you heard it, spread it to others. You don't have to be a mental health professional to talk to people about mental health and to be a beacon and a light and to be hope to others, and for people to realize, oh, she won't think less of me because of whatever I'm going through. That's what people need. They need psychological safety. They need to know that you're not going to treat them differently because of the circumstances that they are going through. Okay? So that is my hope for all of you, that you go and share this with your family and your friends so that they can feel more comfortable with talking to you and they know that they have an advocate in you. Pastor Beeman is passing out my business card. As Dr. Beeman told you all earlier, I own Psych Life Tico. I opened that business back in December, and I have on a shirt today. It says, "Give yourself another try." This is one of the shirts that, I created in the business. But the reason why, and I'll say this really quickly, the reason why I created this company is because wouldn't it be so wonderful if, just like you had on a Nike shirt and people realized you like Nike, and I had on earlier today, I don't know if you guys saw me take this off, but look at this. This had my badge on it. It says Auburn University, right? So what are you going to know by me having this badge on? I'm an Auburn fan. You're going to know that without even me opening my mouth. What if you had on a beautiful, brightly colored shirt that's adorned with messages of hope? And as people get off of the elevator onto the acute psych unit or go into the doctor's office and they're feeling uncomfortable about talking about their innermost thoughts, that you greet them with that shirt and it immediately lowers the anxiety. It tells them, hey, I'm talking to someone who's going to support me. She doesn't believe I'm strange. She wants to help me. It automatically lowers the anxiety and the guard of the person that you're talking to. And it gives them a way to start talking to you about what they're going through. It normalizes the conversation. Hey, I support you. I'm here for you. That's what I want people to see and to feel when they step onto any psych unit or into any space where they're seeing a psychiatric professional. So it was a pleasure to speak with you all tonight. I enjoyed it. Yay. Thank you so much for having me. And I guess that's it for me.